Hello viewers, I'm Odhiambo Willis from Kenya. 2016, while I was in Kenya, as I was headed for my graduation overnight, and it was a road accident which was very tragic. I encountered a number of fractures on my hip and on the lower limb as well as my forehead.
Today we are talking about patient Mr. Willis Okoth, 40 years male from Kenya. He has a problem since the last few years in the right hip, for which he has been operated 9 times before. He had a fracture acetabulum for which fixation was done, and then a hip replacement, then plating, it got dislocated, and so many surgeries.
In 2020 to 2021, I was in serious pain again. And when I consulted with the doc, he advised that I better get to India for treatment because he was not willing to do it any further. So I was eagerly making my ways to see Dr. Mannu for this.
He came down to me. We were of the idea that the patient has an infection in the hip, which we confirmed by bone scans and few blood tests. So what we planned was a 3D imprint of the implant in the pelvis along with the hip replacement.
The treatment was very good, and the team worked passionately. Throughout the operation, I wasn't in pain, and a week later still I couldn't feel pain because of the specialized treatment that I received in Max Hospital.
But now, after a month, the patient is good enough, he's walking, he's painless. Before the surgery, he had pain scale 10 out of 10. Now the patient doesn't have any pain, he's walking, he's doing day-to-day activities, and we have wished him best of health and best of luck for the future.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.